Every life is invaluable and precious. When medical emergencies like a cardiac arrest happen around a person, it is important to be prepared. You can help someone in a medical emergency only when you're clear as to what is to be done in such a situation. If you are aware and informed, then you can take steps to revive a person and save their life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation, also known as CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness then and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It is even more important to learn about CPR if you have a loved one who has a history of cardiac disease, as research reports actually show that majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. On the broadcast, we have with us Dr. Ankit Gupta, Assistant Professor, Department of Cardiology from Raebareli, AIIMS, and Dr. Ashish Deshpande also joining us this afternoon. He's a consultant interventional cardiologist at Orient City Care Super Speciality Hospital in Aurangabad. Also on the broadcast, joining us, Dr. Divij Khaitan, consultant interventional cardiologist from the Khaitan Heart and Super Speciality Hospital in Rajasthan's Jaipur. Dr. Gupta, I'd like to begin with you. The term cardiovascular disease often induces fear as cardiovascular diseases are the leading cause of death globally. What is cardiovascular disease and does it mean a heart attack?
Yeah, it is very important to know about the cardiovascular diseases as it is the most leading cause of death globally, and it accounts around 18 million mortality annually from the cardiovascular diseases. And out of these, 85% is just due to stroke or heart attack. So basically, cardiovascular diseases are the group of disorders of heart as well as the blood vessels. That includes coronary artery disease and stroke, peripheral artery disease, congenital heart disease, and cardiomyopathies. So these all are because of rapid urbanization, increasing the risk factors like healthy diet, physical inactivity, tobacco use, harmful use of alcohol, and moreover in the patients having uncontrolled diabetes, sugar, raised blood pressure, and lipid profile, overweight. So these all are the risk factors which increase the heart attack, heart failure, and other fatal complications. So I suggest to all our listeners to take precautionary checkup of yourself as well as to your elders yearly at least, so that we can make the awareness of the cardiovascular diseases and can prevent fatal complications.
Right, this feels like an appropriate time to bring in Dr. Deshpande. Doctor, can a family history affect the likelihood of having heart disease? And what are other common causes of heart disease?
Yeah, definitely a person who is having a family history has a high chance of having a heart disease. Now, when we say family history, what does a family history mean? A family history generally we define that having a first degree male relative like a father or a brother who has had a heart attack by the age of 55, or a first degree female relative like a mother or a sister having had a heart attack by the age of 65 years. And it definitely increases your risk of having heart disease. But even if you have a family history, you have a lot of chances to lower your cardiovascular risk of getting a heart disease simply by following a healthy lifestyle. Now, what other causes of heart disease, if you say, basically it is a buildup of fatty plaques in the arteries of the heart, which leads to coronary artery disease. And the risk factors, as the previous doctor had suggested, are unhealthy eating habits, lack of exercise, obesity, smoking, high blood pressure, high blood sugars, especially uncontrolled diabetes, and excess weight, and typically a high body mass index. This worsens all the other risk factors. So if you control your risk factors well, if you have a healthy eating habits, healthy exercising. That is, if you have enjoy your life in such a style that you eat vegetables, fruits, whole grains, and overall a healthy diet. Plus, if you exercise for the prescribed time a day, even sleep. Sleep is also one very important cause. So, sleep of 7 hours a day is very essential to maintain a good cardiac health. If you follow all these things, definitely you will have a good cardiac health, and you can lower your chances of getting a heart disease.
Right, crucial advice there. Dr. Khetan, but it's still a grave shock to hear that an apparently healthy person underwent a sudden cardiac death during their time in the gym. How do we then understand it in this perspective?
Yeah, recently we are seeing many young patients, they are dying suddenly in the gym. Physical activity is very good, either as a profession or as your hobbies or as a sports activity. But the persons, those who are dying suddenly in the gym, they are usually having advanced heart disease and they are not aware of them. So the most common cardiac problems are the coronary artery disease, some hypertrophic cardiomyopathies, as well as arrhythmic heart disorders. These people, they are more prone for sudden death during the heavy exercise. Most commonly it is the coronary artery disease if you are above the age of 40 years of age. So if you are not doing regular exercises and you have a sedentary lifestyle, so you are more prone for sudden attacks as compared to the persons those who are doing the regular activities. So what I suggest, if you are having a heart disease and you have a sedentary lifestyle, better to consult a physician or a cardiologist before taking over any vigorous activities. Thank you.
Right, crucial information there. But Dr. Ankit Gupta, what are some signs that something may be wrong with one's heart?
Firstly, we should know the heart disease is very broad term, and most of the people take heart disease as a heart attack or coronary artery disease, where we usually get the chest pain, discomfort, heaviness, tightness. Though coronary artery disease or the heart attack, they are the very most common form of heart diseases, but we should not ignore other heart diseases. Uh, that includes the heart muscles, valves, abnormal electrical system, or even the lining of the heart. So that causes the abnormal contraction and relaxation. So there are few warning signs of the heart diseases like coughing, wheezes, extreme tiredness, fatigue, loss of appetite, frequent urination, rapid heartbeat, or shortness of breath, swelling over the feet or ankles, stomach. So one should aware of these warning signs of the heart diseases and consult their cardiologist as soon as possible to prevent further progression of the disease.
Right. Dr. Ashish Pandey, there we've highlighted all the warning signs of heart disease. But let's talk about atrial fibrillation. It's the most frequent cardiac arrhythmia. What happens within the heart during atrial fibrillation, if you could break that down for us?
Yeah. See, basically, atrial fibrillation is an irregular rhythm of the heart that begins in your heart's upper chambers called the atria. The heart beats chaotically, sometimes at rates more than 500 per minute, the atria, and the normal cycle of the electrical impulses in your heart is interrupted. This leads to basically a fast, chaotic rhythm and poor movement of blood from your atria to the lower chambers, that is the ventricles, and consequently from the ventricles to the other parts of the body. The patient feels the irregular heartbeat, he may get palpitations, he may have lightheadedness, he may feel extreme fatigue, shortness of breath, syncope, chest pain. And the main risk of having atrial fibrillation is that heart rhythm becomes irregular and hence clots form in your heart. And these can get embolized to different parts of the body, especially the brain, landing you into a stroke or an episode of paralysis. So in part, atrial fibrillation is also preventable because the risk factors include advancing age, high blood pressure, obesity, diabetes, heart failure, thyroid and kidney disorders, smoking, and moderate to heavy alcohol use. So again, if you have a good lifestyle, partly atrial fibrillation is also preventable.
Right, Dr. Khetan, which group of people has the highest risk of developing atrial fibrillation? And what are the most common complications of atrial fibrillation?
Yeah, as the sir said, the most common cause is the advancing age. With the increase in the age, the risk for the atrial fibrillation also increases. There are multiple risk factors for the atrial fibrillation. So we break down as a age, uncontrolled hypertension, if it's uncontrolled for a very long time, long standing type. Patient who do binge drinking, they are very much at a risk of atrial fibrillation. If you have a very strong family history, If your parents or your brother sister have a history of atrial fibrillation, then yourself you are more prone for atrial fibrillation. Then there are many multiple risk factors like diabetes, patient who have asthma, patient who have any other chronic kidney diseases. They are very much prone for atrial fibrillation. Since the atrial fibrillation causes the formation of embolus, so the complication which occurs is most commonly the stroke. The emboli goes to your brain and you develop a paralysis. This embolus can go anywhere in the body. It can go to your lower limbs, and it can go into the heart also. It can cause heart attack. So yes, AF can cause very much complications.
Right, with that, we're slipping into a very short break, but our eminent cardiologists stay on with us to help you understand sudden cardiac death and the role of CPR. We are in conversation with experts who help you understand sudden cardiac death and the role of CPR. Let's go across to Dr. Ankit Gupta. Dr. Gupta, can atrial fibrillation cause sudden cardiac death?
Yes, recent data suggest that atrial fibrillation is associated with increased risk of sudden cardiac deaths. And as we all know, that atrial fibrillation is the most commonest arrhythmia worldwide. So there are various causes because of that. Can be because of the disease at the level of heart muscle, valvular heart disease, or ischemic cardiomyopathy. So for the listener, I would like to tell few triggers of the atrial fibrillation. Like firstly, the caffeine. That is the higher amount of the caffeine intake, like in energy drink, coffee, or anything like that, can triggers the atrial fibrillation. And secondly, the higher amount of the alcohol ingestion can trigger the atrial fibrillation we term as holiday heart syndrome. Or even in the people who are taking alcohol on a daily basis. Again, the overweight of unhealthy diet, lack of exercise, fatigue, and excessive physical exertion, sleep deprivation, and as well as the emotional stress can also trigger the atrial fibrillation. So sleep healthy, eat healthy, or do the regular exercises.
Right, very crucial points there. So high amounts of caffeine can trigger atrial fibrillation, high amounts of alcohol consumption. You mentioned that it can also be triggered by lack of sleep. But I'd like to bring in Dr. Deshpande at this point. It's been clear now that survival from sudden cardiac death is possible, but with fast and appropriate medical care. Dr. Ashish Deshpande, how soon then should CPR be started after cardiac arrest? And what is the first thing you should do if someone goes into sudden cardiac arrest?
Well, survival from sudden cardiac arrest is definitely possible, but the CPR has to be very fast and very prompt, because the brain normally sustains lack of blood supply for about 4 minutes, and after that irreversible changes start happening in the brain, which may land the patient in neurological, neurocognitive dysfunctions. So the earliest you recognize that the patient is having a cardiac arrest, CPR should begin. And what is the first thing you should do? First, you should confirm that the patient is non-responsive. Either tap him on the shoulder, shout at him, and when you confirm that there is no pulse, there is no respiration, you immediately call for emergency help. You dial 108, you call the bystanders for help, because however trained you are, you alone may not be able to give the most effective CPR, whatever is required. Now, when you have called your help, then you lay the patient flat on a firm surface and you start cardiac compressions. The cardiac compressions should be such that there should be a minimum of 2-inch depression of the sternum at the center of the chest, and this should be done at a rate of 100 to 120 times per minute. And you have to continue this until either help comes in the form of some cardiac ambulance or there is return of spontaneous circulation. That is, if you feel that a patient's pulse is there or the patient has started breathing, then you can stop CPR. Otherwise, you have to continue it.
Right. Dr. Divij Khaitan, for those of our viewers who may be unaware, can you please explain the process of CPR and how it should be done?
Yeah, first we have to check if the patient is alert, is unconscious. We have to tap on the shoulder, we can shake the patient, we can shout at the patient. If the patient is unalert, we have to call for some help. We have to lay down the patient on the flat ground floor and then we have to start the CPR. First, we have to keep our one hand over the center of the chest. We have to lock our hands on the back. Keeping our elbow at the straight, we have to start the chest compression. This is basically a bystander CPR. So what the compressions rate should be? Should be around 100 to 120 compressions per minute, and it has to be around 2-inch deep. Don't press hard because it can break your ribs also. So we have to continue doing our CPR till the patient regains any consciousness or if there is any medical help arrives. So this is how we do the CPR.
Right. Dr. Ankit Gupta, can someone who has already suffered a cardiac arrest have another one?
Yeah, it is very important to know there are various causes of cardiac arrest. So it can be reversible causes or the irreversible causes. The reversible causes are like hypoxia, hypovolemia, electrolyte imbalance, which can be balanced with in the hospital, and as well as there are various irreversible causes like genetic or familial disorder of the heart muscle or the electrical system of the heart. So one should get diagnosed properly with the cardiologist the exact cause of the prior cardiac arrest, and get aware of many device therapies like implantable cardiac defibrillator for the prevention of another cardiac arrest.
Right. Also, Dr. Ashish Deshpande, how long does it take to recover from cardiac arrest, and what are the treatment options, if you could break that down for our viewers?
Yeah, see, most of the patients who experience cardiac arrest outside the hospital do not survive. But as we just discussed, very effective and very prompt CPR, patients can be revived, and if it is not too delayed, then they may escape without any neurological dysfunction or brain injury. But then you have to search for a cause, whether it was ischemic heart disease, that is blockages in the coronary arteries. You may treat them by revascularization, angioplasty or bypass. If patient has an arrhythmogenic substrate whereby he has had that cardiac arrest, he may require ablation or he may require ICD, as the previous doctor said. So patients may need to be evaluated for all the underlying causes, and then they have to be treated accordingly to prevent another episode of the same.
Right. Dr. Divij Khaitan, with the intake of painkillers becoming a norm now, whether it's for a headache or for fever, I want to understand, does taking painkillers increase the risk of heart attack or stroke?
Yeah, if the frequent use of NSAIDs are there, they definitely increase the risk of heart attacks and stroke. If the patient has underlying heart disease, they are very much prone by taking these NSAIDs to increase their risk of heart stroke. So what I suggest, if you want to take NSAIDs, take in a very lowest dose and for the smallest period of time. Also, you can try any alternative therapies if you have pain like aching muscles and all. So you can have a cold and hot therapies. You can take physiotherapies also instead of taking NSAIDs. So these alternative therapies are also very much useful. So don't take any medications without taking your doctor's advice.
Right, let's focus a little on diet now. Dr. Ankit Gupta, what types of food should one eat to avoid or sort of better manage cardiovascular diseases?
Food, usually the people who gets the heart diseases are because of the deranged lipid profile, blood pressure, and deranged sugar level. So one should be very diet conscious about their diet, like less sugar and less lipid fatty foods diet, like junk foods. We usually take the pizzas and burgers, and these all are the main causes for the making the other diseases like diabetes or other heart diseases. So one should be concerned with the dietitians if they are having the prior various risk factors of cardiovascular diseases.
Right, another concern also is that people who survive one heart attack are at risk for another. Dr. Ashish Deshpande, what precautions should they take to reduce the chances of a second heart attack?
Once a patient has a heart attack, he should take all the proper steps that are essential in the secondary prevention of heart attack. First includes medicines. He has to take meticulously the antiplatelets, the statins, the lipid lowering drugs and the plaque stabilizing drugs. And other than that, as we have described, for primary prevention, diet, exercise, a healthy lifestyle, that is. And the lifestyle includes everything that you do throughout the day, not only your eating and exercising habits, eating, walking, sleeping, everything is included in that. So you should take care of all his daily day-to-day affairs along with the proper medicines so that he can have prevention of the second hand.
Right. As we wrap, Dr. Divij Khaitan, is angioplasty or bypass surgery the only option to treat a heart attack? And if you could also brief our viewers on how safe it is.
See, the heart attack is 1 hour is the golden period. The earliest we open the arteries, the best we can preserve the heart. So angiography is the diagnostic test. If it is a blockage is there, it's a 100% blockage. We call it ST elevation MI. So we should open this by angioplasties. Depending if the patient has a multivessel disease and a very heavy calcified disease, or there is very severe lesions are there, bypass is the second alternative. So in an acute heart attack, the first option we always prefer for angioplasty. This open up the vessels very fast. If the patient has no option, if it's in the periphery, then we go for medical therapy where we thrombolize these attack patients with the drugs. So yeah, the first option should always be early intervention. Otherwise, the medical therapy is the second best option.
Right. Thank you so much, doctors, for joining us on the show this afternoon. And thank you so much, all of you at home, for watching.